Breaking news alert. Major changes to NHS GP services have officially landed as of April 11, 2025. If you're over 60, these updates could dramatically reshape how you receive care. Say goodbye to those frustrating early morning phone marathons at 8 a.m., desperately redialing in hopes of snagging a same-day appointment. The old system, which left thousands of seniors in limbo for days, even weeks, is being replaced. Welcome to Pensioners Power, your trusted source for everything you need to know about pensions, retirement planning, and financial wellness. Here, we cover the latest news, expert insights, and essential updates to help you maximize your retirement years. Whether it's understanding pension schemes, making the most of your savings, or staying informed about financial changes, you're in the right place. If you're new here, don't forget to hit that subscribe button and turn on notifications so you never miss an important update. Now, let's jump right into today's topic. But hold on. Before you start celebrating, this isn't just a simple policy tweak. It's a complete overhaul of how primary care works across the UK. From how you book your appointments to who you actually see when you step into your local GP surgery. This reform touches every corner of the patient experience, and for older adults, especially, knowing how to navigate this new system could mean the difference between feeling cared for and being completely overlooked. Under the new rules, GP surgeries must offer more flexibility in how appointments are made. That means no more mad rushes to get through on the phone line first thing in the morning. Practices are now expected to allow patients to book appointments throughout the day, whether that's over the phone, face-to-face at the reception desk, or online. While this sounds like a win, the reality is that many pensioners still struggle with digital technology. For those without a smartphone, internet access, or even an email address, this shift toward digital booking can feel more alienating than helpful. It's one thing to offer online services, it's another to ensure they're actually usable by the people who need them most. This tech gap raises significant concerns about accessibility, especially for older patients who may lack the digital literacy or support to confidently use these new tools. Another exciting change being introduced is the return of what's called continuity of care. This means the system will strive to ensure that patients, especially those with long-term conditions, are consistently seen by the same doctor. For seniors, this is a massive step forward. Seeing a familiar face who already knows your medical history, medications, and preferences can make a world of difference in both diagnosis and comfort. But as promising as that sounds, questions linger. Do surgeries actually have the staff to make this happen? Can they maintain consistency when so many practices are already stretched thin? Only time will tell. To support this goal, NHS leaders are lifting some of the bureaucratic burdens that have weighed down GPS for years. Targets demanding excessive box ticking and paperwork are being reduced, aiming to give doctors more face-to-face time with their patients. The idea is simple: fewer forms, more care. This could mean longer, more meaningful appointments, something older patients have long been asking for. But will this really translate to better care, or will new administrative demands just fill the space left by the old ones? Backing these reforms is the largest investment in UK primary care in over a decade. Hundreds of millions of pounds are being injected into GP services to help modernize surgeries, hire new staff, and upgrade equipment. For pensioners, this funding has the potential to change everything: shorter wait times, quicker diagnoses, and more support for chronic illnesses. But here's the kicker: where exactly is that money going? Will it actually reach the surgeries in need, or will it disappear into layers of NHS management? Alongside this financial boost comes an expansion of the GP team itself. You're now likely to encounter a variety of healthcare professionals at your local surgery, from physiotherapists and pharmacists to mental health workers, all under the same roof. The goal here is to relieve pressure on GPs by having other qualified professionals handle specific concerns. If you've got a bad back, you might see a physio right away, rather than waiting weeks for a referral. In theory, this makes care more efficient, but what if you simply prefer to see your doctor? For many seniors, relationships matter. Seeing someone new each time can feel jarring, rushed, or even dismissive, especially when you're dealing with complex or sensitive issues. And then there's the push toward digital healthcare, perhaps one of the most controversial elements of this transformation. Patients are being urged to manage their own medical information online, from booking appointments and checking test results to reviewing prescriptions and accessing health records. While that's convenient for tech-savvy users, many older adults still struggle with these systems. Digital exclusion isn't just a buzzword, it's a real issue. Without clear guidance and support, thousands could be left feeling isolated and disconnected from the care they rely on. Bridging this gap isn't optional, it's essential. NHS officials are also emphasizing prevention, particularly regarding chronic illnesses like heart disease and diabetes. More proactive checkups, regular blood pressure screenings, and cholesterol tests are being encouraged because catching these conditions early can significantly reduce hospital admissions and support independent living. But these efforts only work if patients can actually secure an appointment and if surgeries follow through with the necessary care. Without that, prevention becomes another missed opportunity. Vaccinations are also front and center in this new model. Flu jabs, pneumonia shots, and shingles vaccines are being prioritized, with practices receiving financial incentives to ensure older patients receive them. This could lead to more regular outreach, appointment reminders, and home letters practical changes that could help vulnerable seniors avoid serious illness altogether. However, as always, the success of this plan hinges on how it's executed at the local level. One often overlooked detail in this overhaul is staffing resilience. When your regular GP is away due to sickness leave or retirement, surgeries are now receiving extra funding to hire locum doctors or temporary replacements. This aims to ensure fewer disruptions in care and more appointment availability for patients. This could mean the comfort of knowing they won't be turned away when they need help. But again, continuity may suffer. Locum doctors often don't have the same level of personal familiarity with a patient's history. That subtle but powerful connection between doctor and patient is harder to maintain in a system reliant on rotating staff. To tie it all together, the NHS is launching a new patient charter, a formal document outlining what you can expect from your GP practice. It sets standards for appointment times, communication, and quality of care. It's meant to empower patients to hold practices accountable and demand better service. For many seniors, having something written down, something official, can make it easier to speak up when expectations aren't met. But again, promises on paper are only as good as the effort behind them. If these charters aren't enforced, they risk becoming just another piece of NHS jargon. So, what's the bottom line? These sweeping reforms to NHS GP services could truly mark the start of a new era in UK healthcare, one that is more responsive, more efficient, and more patient-centered. But the real impact will depend on two things: how well these changes are put into practice, and how ready seniors and their families are to adapt, advocate, and stay informed. The NHS says it's building a system around the patient. If that's true, it could transform the lives of millions. But if these reforms are mishandled, they could just as easily deepen the cracks that already exist. Thank you for watching Pensioners Power. If you found this video helpful, be sure to give it a thumbs up and share it with others. Stay informed, stay engaged, and we'll see you in the next video with more insights on the issues that affect the UK. Take care, and don't forget to subscribe to my channel for all the latest updates.